Reporter for today is Betty Cross from CBS Austin. I'd like to now hand it over to Director Hayden.
Good morning. As we look at the risk levels, we must consider our personal health and risk and our well-being as a whole. We know this virus is especially dangerous to those with underlying health conditions, and we want to protect those populations. Austin Public Health has programs and partnerships, and we have resources for those working and unemployed. We want to ensure that you stay healthy and meet your basic needs. It is so important for you to keep that in mind during this economic time of uncertainty. It is important for the services that we offer to be culturally and linguistically appropriate and have an equity lens. We are working through our Emergency Operations Center, and we have established a social services branch. And we are working with priority populations as well as ensuring that these services are being provided. For example, our women, infants, and children services are available for you and your families. Our neighborhood centers are continuing to provide assistance by phone and can assist you with food, utility, and rental assistance. We have child care subsidies that are available to essential workers. Our Families Connect program allows the ability for you to receive a visit from a nurse for your newborn. We know that when we think about health, we've got to think about mental health. We want to think about our whole health. And as we think about that, we have partnered with Integral Care, and they are available 24/7 to provide mental health assistance. We have partners that are assisting with victims of domestic violence. We know that that is occurring in our community. And as we know, there are several of you that are unemployed. We are partnering with Workforce Solutions to ensure that there is connection to employment. Testing is so important. We really cannot emphasize the importance of testing. We have free testing available for those with symptoms. We will not ask about your immigration status. At this point, I am going to turn it back over to our host, and thank you for the opportunity.
Thank you, Director Hayden. Dr. Escott?
Thank you so much for having me. I want to talk about our new risk-based guidelines. And I think this is the right timing for this because I know, like many people, when I go home at night, my wife and daughter every single day ask me, can I go shopping? Can I get my hair done? Can I get my nails done? And the answer to that question for people across the community is different. It's different based upon their individual risk. It's different based upon the risk in their household. So I'm going to pull up our slides right now and show you the risk grid, which goes through some of these processes, how people can decide what they should do for themselves and their family. I know there's a lot of conflicting information out there going on. And, you know, I think we all want the same goal. It doesn't matter if you're Democrat, Republican, state government, local government. We have to care about both things. We have to care about public health, and we have to care about the economy. And this will help us get through those situations. It'll help us answer the questions that need to be answered so we can continue to help the economy while protecting public health. So, you know, I want to thank our large group who's been working on this for several weeks. This included our expert panel. It included our partners at the University of Texas. It included our elected officials. And this is what we've come up with. This is our first iteration. There could be changes in the future. So I want people to be aware of that. But currently, this is the model that we've created. And through our review in the expert panel and the stakeholders, we've identified that the city of Austin and Travis County is at a stage 3. It's important to understand that different jurisdictions across this state and across this country are going to be at different stages of this pandemic at different times. This is not designed to be a policy document. This is designed to be a guide for individuals to assess their risk based upon what's happening in their community. You know, a lot of people have asked me, what are the triggers? How are we going to determine how we move from stage 3 to stage 2 or stage 3 to stage 4? And the answer is we are working on that. Tentatively, we are looking at hospitalization rates, the admission rates of new patients and how that changes on a rolling 7-day average. But there are other components. As much as we'd like to identify one highly reliable trigger, there are lots of triggers. So we will be looking at hospitalization rates. We will be looking at doubling time. We will be looking at our R0, or that reproductive number, as well as some other items. If we can find a magic formula to share with you, we will share that with you. Otherwise, it would be based upon expert opinion, looking at multiple different factors to make the determination of what stage we are in. I will say that that these guidelines are variable based upon the individual's risk. So for instance, at stage 3 right now, we're recommending everybody practice good hygiene, staying home if they're sick, avoiding sick people. As you can see, that particular set of guidelines is consistent throughout this. We're also advising everyone to maintain social distancing. We're advising everybody to wear facial coverings. We're advising those who are at higher risk to be a bit more cautious when it comes to gatherings and dining and shopping. So we're asking them to avoid social gatherings and gatherings greater than 10. We're asking them to avoid non-essential travel. We're asking them to avoid dining and shopping unless it's essential for them. So if they need to get groceries, for instance, if they can't have somebody else get them for them, then they need to do that, but do that in a protected way. And again, on low-risk individuals, they can take a bit more risk because the risk of complications, the risk of hospitalization, the risk of death is lower substantially than those who are at higher risk. So for those individuals, we want them to be able to go out. You know, they can do social gatherings, but they can also go to more non-essential travel, the shopping, the dining. But when they do so, they need to do it with appropriate precautions. Again, all of us, public health officials, governmental officials, the community itself, want to have a healthy economy, but also want to have public health and safety. And if we can embrace those two concepts together, then we can stay open and we can do it safely without risking a substantial surge. I do want to show you a few other slides in addition to this. You know, stage 1 through stage 5, we're going to define those a little bit later. As you can see, stage 5 is akin to our shelter in place or stay home, work safe. Stage 1 is a period of time where we haven't had any new cases. It's relatively safe. The disease isn't gone yet. It's still around, but it's not around in this community right now. And that's why you see progressive lifting of restrictions or lifting of the cautions we're advising people to take as the stage number decreases. So when I talked before, I talked about some of the factors that we're looking at. And what you can see on this slide is 3 things. Number 1, you can see our cumulative rate. That's always going to be going up, right? It's a cumulative number. That's the one in red. The yellow are the new cases per day, and the green is the % change compared to the previous day. So what this is showing us is that as we've progressed over time, our rate of increase continues to decline. So where we had a doubling rate every day early on, now our doubling rate is around 23 days. So this is a good sign for us. This is why we are willing to accept more risk, be more liberal when it comes to things like dining and shopping and going out. This is a graph of our COVID-19 new confirmed cases. So this is from the graph I showed you before, the yellow bars, but magnified a bit. And what you see is a 7-day rolling average of new cases. As you can see here, that number has been relatively steady for around 6 weeks. So again, we have flattened the curve. This is evidence of that flattening of the curve. But again, we have to remember that the flattening of the curve happened because of actions that all of us have taken. The staying home, the being cautious, the social distancing, the personal hygiene, the wearing of facial coverings. This does not mean we are cured of COVID-19. And I'll give you an example. I'm an ER physician. I see patients in the ER all the time. Sometimes I'll see a patient who comes in, let's say, for something like seizures. And, they come in because they have another seizure. And, I ask them, have you been taking your seizure medication? And the answer sometimes is no. And the reason is because when somebody has something and they don't have that something for a while, like a seizure, they think they're cured of the epilepsy. But what they're experiencing is an effect of the treatment. Similarly, what we are seeing in the flattening of the curve is an effect of the treatment. And that treatment is that social distancing, that personal hygiene, and those facial coverings. The treatment has to continue. We have to continue this effort because we are not cured of COVID-19. And we will not be in a situation to be cured of COVID-19, at least until we have an effective vaccine which is available publicly. The next slide is cases by week. So these are newly diagnosed cases that we've seen on a week-by-week basis, Sunday through Saturday. Again, you can see that the numbers, while they're increasing a little bit now, have been relatively steady over the past 6 weeks. Some of this increase that we're seeing in the last 2 weeks may be attributable to our increased testing that we're having through our public testing site, as well as increased testing through our partners at Community Care and others in the community like our hospital systems, like Austin Regional Clinic and others. So we look at hospitalizations because there's some variability in the rate of detection of cases across communities. And what we see here is that while we've had a steady increase in the cumulative number of hospitalizations, that's the line in the gray, it's been slow and it's been cumulative over time. So let me give you a little closer view on the new hospitalization rate. And that's what this one is. So the blue is new hospitalizations by day in our 5-county MSA. The yellow is that rolling or moving 7-day average. And you can see that that's been oscillating between about 7 and 10 hospitalizations on that moving average for many weeks now. Again, the hospitalization curve is flat, but that's a result of the efforts that all of you at home have been doing to flatten this curve. If we stop doing those cautious things, if we stop the social distancing and the public masking and the attention to personal hygiene, it will not be flat anymore. And again, what we all want is to keep it flat so we can keep things open. And finally, I want to remind everybody that Austin Public Health has free assessment and free testing for COVID-19. Anybody who's symptomatic is getting tested. Anybody who has an exposure to COVID-19 who's asymptomatic is getting tested. And it's all free through this website, the austintexas.gov/COVID-19. We encourage people to go to this site, to sign up, to schedule testing. We want people to get tested or schedule testing the same day they first develop symptoms so that we can get them tested as soon as possible. We can identify if they're positive or negative as soon as possible, and we can help to isolate them so that the exposure doesn't happen to others. We can connect people to our isolation facility, which is a free hotel room with meals provided, with internet provided, with television provided, so that they can isolate away from their families. We have seen recently increases in the numbers of household transmissions. So from one member of a household to others. So it is really, really important for us to separate people effectively so that we can prevent that transmission in a household and so that individuals who are COVID-19 positive can protect their families. With that, I'll turn it over to Betty for questions.
Thank you, Director Hayden and Dr. Escott. Ms. Cross?
Yes, thanks for taking this time with us this morning. And Betty Cross with CBS Austin. And our first question is from Bridget Spencer at Fox 7. She says, I think this is probably for you, Dr. Escott. Where are we when it comes to testing capacity?
So, Betty, our testing capacity has been increasing. Again, we have the capacity right now to test at least 2,000 people a day, or a week, sorry, through Austin Public Health. But what's also been increasing is our testing with our partners. Community Care, Austin Regional Clinic, our hospital systems are testing more frequently now. They're testing preoperative patients. We're testing nursing home residents and staff. We're testing at construction sites. And we intend to not only continue our efforts at advising people to sign up for that COVID-19 drive-through testing, but also some more targeted testing to ensure that we are providing direct outreach and targeted testing to those individuals and communities who are at higher risk for transmission.
When you talk about that direct testing, are you talking about by zip code? Are you talking about by, let's say, construction workers or grocery store workers, the people who you have said in the past are a higher risk group?
So, Betty, we are working with a collaborative of individuals from across our community, specifically related to testing, so that we can bring the data together. As you saw when the mayor issued his new order, it required all individuals doing testing, all entities doing testing, to report that daily to the local health authority and to the state. That was reiterated yesterday by Commissioner Hellerstedt. So right now what we're trying to do is to bring all these data sets together from these different entities so that we can better identify where we're testing well and where the gaps are in testing so that we can better target testing for those who are not currently being reached.
The next question is from KUT. It is, what is to be determined about guidance for sizes of gatherings for lower risk individuals under stage 1?
So, Betty, the to be determined really depends on the situation outside of Austin and Travis County. Again, the large gatherings were the first thing that we closed down and will be the last thing to open up again. But I imagine that's going to happen in a progressive process. So you see that we've put a limitation of 25 in stage 2. As the situation changes and improves locally in our region and our state, we'll continue to increase that cap so that we can have events, we can have larger gatherings as the situation becomes safer. In addition to this, our Environmental Health Services group is working on some projections for large events going through the end of this year so that we can have a better idea of what we think at this stage is going to be feasible and what's really off the table when it comes to large gatherings for the foreseeable future.
This is a question from CBS Austin. I know you said during the press conference part that you don't have exact triggers yet. Do you feel like maybe the stages are premature without specific triggers to move between them? I mean, do you feel like it could become somewhat arbitrary?
But yeah, I don't think it's arbitrary. Again, as we've said before, this forecasting that we're doing for COVID-19 is really unprecedented in terms of infectious disease spread of this magnitude. So, similar to weather forecasting, you don't forecast weather based only on dew point or only on wind speed. It's a combination of factors that are involved in creating that forecast. Similarly, we're looking at multiple different factors, and those factors are being discussed by that expert panel to make a determination. It's not arbitrary. It's based upon the experts that we have, that we've brought together, who are interpreting this data to provide an opinion about where we think we are. Again, if we identify a combination that is very predictive of risk, then we will share that, and certainly we want to be as objective as possible when it comes to providing guidance regarding the stages.
The next question is from Austonia. It says, if there is a surge in cases, are city officials able to recommend or implement a second shutdown, or would that have to come from Governor Abbott?
Betty, we are working closely with the state on this COVID-19 response. I strongly believe that the governor, the state government, Department of State Health Services want to protect the community just as much as we do. So this is a dialogue between local and state government when it comes to assessing the need for further restrictions. This document is not designed to guide policy. This document is designed to guide individual behavior based upon their risk. Ultimately, the risk is going to be different for different members of our community, different households in our community. Regardless of what policy changes can be made, we can still make recommendations regarding the community risk that people have for themselves, for their households, so that they can interpret what they need to do personally to help prevent the spread.
This question is from KXAN. Have you seen a significant spike in hospitalizations or other evidence that reopening the economy has been bad for public health?
So we haven't seen a significant spike. I showed you on one of my graphs, there was an uptick in hospitalizations last week. That's come back down again. Again, it takes a while to see the impact of policy change, at least 3 weeks to 4 weeks to really see if there's if opening the window has been too much or just right. We have plenty of hospital capacity still. Right now we are worried about two things. We're worried about the public health impact. We're worried about the economic impact, which has public health effects as well. So we are trying to maneuver between two things to ensure that as we open the economy more, as we open that window more, we're doing it as safely as we can.
This question is from Community Impact. Williamson County's Family Emergency Room is offering free coronavirus test for folks without symptoms and without known exposure to the virus. Asymptomatic testing is a key to reaching adequate testing levels. When do you expect Austin-Travis County can begin offering such tests, especially with APH testing under its current capacity?
So again, we are doing asymptomatic testing right now, but in groups that are at higher risk. So nursing homes, nursing home residents, nursing home staff, construction workers, as I described before. Right now our drive-through testing of people with symptoms has a low positive rates. It's less than 3%. So we want to test more people, but we want to make sure the right people are being tested also. And that's where that collaborative is coming together to better identify those parts of our community that aren't currently being tested adequately, so we can provide outreach and potentially asymptomatic testing in a targeted way.
KView asks, are local healthcare systems preparing for or anticipating any surge in cases in the coming weeks with the state beginning to reopen?
Certainly we are on higher alert. As that window opens, the risk of a sudden increase increases. And our hospitals are aware of that. We meet with them several times a week, the executives from each of the hospital systems, and we have those conversations. We review the data, and we make determinations regarding the risk and the projection. We are very lucky to have our partners at the University of Texas and the Dell Medical School, who feed information daily from the hospitals into the models so that we can anticipate what the projections look like for the next 2 or 3 weeks. Part of the prediction that we're trying to do is to make sure that if we need to make changes in suggestions or potentially changes in policy, basically moving down on the staging, that if we do that, it is in time for us to prevent overwhelming the healthcare system. And that's really the optimization that we're looking for here. We know disease is going to spread. We know COVID-19 is not going away, but what we need to make sure that we prevent is overwhelming our healthcare system and its ability to care for people.
And the next question, I'm interested in this one very much as well. How is the city planning on announcing changes to the guideline stage number?
So the stage will be located on our dashboard every single day. If there are updates on the staging, it will be updated there, and I imagine we will be sending out a press notice in relation to changes. We'll send out stuff through social media and other digital media platforms. We want folks to be very aware of what that stage of risk is every single day, so that they can make a determination for themselves, for their households, how they need to act that day to protect themselves and protect their family.
And to kind of follow up on that, do you feel like this is something that could change almost daily, or do you feel like this is something that would be maybe every few days or even every few weeks?
I imagine it's going to change less frequently than daily. I would imagine that once a week, once every few weeks, it may change. Again, part of that depends upon our community's ability to maintain those safe practices, that social distancing, that personal hygiene, the washing of hands, the not touching the face, as well as the public masking. If we can do that well and continue to do that well, then we can maintain the same stage for weeks or months. But it really does require individuals to be responsible and to do those things which are very easy. I know there's been a lot of controversy regarding masks. There's been challenges or concerns that it violates people's civil liberties. Quite frankly, I think that's ridiculous. I think it is a small step that individuals can take to protect other people, to protect themselves. And it is really something that is critical that we consider if we really want to keep businesses open, if we want to protect workers of those businesses, if we want to protect ourselves and our families. It's a small step that we should all be willing to take in order to keep us as safe as possible and as open as long as possible.
We're going to start with second questions now, and this is a second question from Fox 7. It's after Abbott's order to test all nursing home occupants. Where are we with that, and have we already started doing so?
I'm going to pass that one to Stephanie, who's been working with the Nursing Home Task Force and has the data, some of the data related to the nursing home testing.
Thank you. Currently, we have tested 9 nursing home facilities, including the residents and the staff. This was before the governor implemented his order, and we are going to collaborate with the state moving forward to ensure that all of the testing does happen. So we are in the planning stages to finish to implement that. The state will provide the testing kits, and the city of Austin will utilize our existing team to do those tests.
Do you have a time frame on that? Are you expecting that to happen within days, or would it be more like weeks?
We're anticipating that is going to happen over the next couple of weeks.
The next question is from KUT. Is it envisioned that the community will ever be below stage 1? In other words, is there a chance we'll just ever go back to normal?
So Betty, I certainly hope so, and I think so. Really to go beyond stage 1, we really need a vaccine that's broadly available to the public. We're going to have to reach herd immunity to really be in a much safer situation. We really need to identify effective treatment that can be given early in the course of illness, similar to what we have with influenza, if we want to be in a safer place. But I think that's going to take some time. I think the earliest that we're going to be able to have a vaccine would be closer to a year from now. And quite frankly, there are some behaviors that really are not ever going to change or should not change. That attention to personal hygiene, that staying home when you're sick, that avoiding sick people is general guidance that we should all follow. We see influenza across this country every single year. The same interventions that we are recommending now are interventions that are effective for flu and other respiratory viruses that we really need to incorporate into our society to really mitigate the spread of disease.
The next question is from Estonia are we seeing any new case clusters develop, or is APH mostly monitoring those existing clusters, such as the 16 identified at long-term care facilities?
So our epidemiology team is continuing to monitor clusters, particularly as they relate to facilities. We've seen some of those clusters grow. We've seen many of them stay stable over a period of weeks, and we'll continue to monitor the situation. We have a large team that's working hard to track down cases. These are our disease investigators, and they will continue to do so. We also are really focused on preventing the introduction of disease into these facilities, particularly nursing homes, because we've seen over and over again, both locally and across the state and across the country, that once COVID-19 gets in and takes hold, it's really very difficult to prevent further spread. So we're going to be focused heavily on helping to continue to reinforce those nursing homes in particular, to strengthen their defenses, to ensure they have appropriate PPE and practices, and really prevent the introduction. Again, this is a cooperative effort between us, between the state and the federal government, who are now also very focused on this particular issue.
This is a question from CBS Austin. One of the interesting things, there were quite a few of them, but one of the interesting things you talked about was the increase in household transmissions. What does that spike look like, and is that not extremely difficult to address?
Betty, we're working on a data set so that we can graphically display some of this information. But talking to our epidemiology team, in our discussions, they've seen increasing rates of household transmission. And this is somewhat to be expected as disease transitions into communities that are more congested in the household. And this is one of the reasons why we continue to stress the importance of people isolating themselves outside of their home, using that isolation facility, that hotel, to recover in, is going to be very helpful at preventing further spread within that household. The more congested the household, the higher the risk of spread to other household members. We saw this in the Wuhan, China outbreak. We've seen it across the globe in other outbreaks. That household spread is significantly enhanced by having multiple generations, in particular, of folks in one household.
This is a question from KXAN. Why are you releasing this chart now? Are there any concerns about this causing even more confusion for people when it comes to what guidelines to follow and what to do?
Again, we've been working on this for several weeks now, and what we want to do is to provide some clarity. There's been some changes in policy at the state level, which has limited our ability to change policy at the local level. But ultimately, what we need is not necessarily only policy change. We've been saying all along that the most impactful thing that we can do together is individual responsibility. It's individual behavior. So this is a way for us to communicate what we think as public health officials, as medical experts from our expert panel, think you should be doing right now at this stage to protect yourself, protect your family, and protect this community. And I think this is the right time for that.
Community impact.
Sorry, just a heads up, y'all. This is our second to last question.
And this is from Community Impact. When will we have occupational data on the coronavirus cases?
Our team is working on that occupational data now. As you can imagine, sometimes occupational information is challenging to bring together. For anybody who's done an occupational survey, for people like me, it's a bit difficult. Do you choose healthcare? Do you choose governmental employee? How do you classify yourself? So they're working through that data, trying to put it together in a meaningful way so that we can share that publicly. My hope is that within the next week or so, we'll be able to share that graphically and follow that over time.
And our last question, and let me preface it by saying thank you for your time, both of you. We really appreciate it. And our last question is, what plans does the city have for educating residents of low income or public housing or community members from afflicted groups about the new guidelines?
We have a social services branch that is working with our equity office to ensure that we are providing this outreach and education. We are going to partner with the Housing Authority as well as other partners, social service providers that are continuing to provide service in this space. And so we know that there is an opportunity to meet people at parks and in those spaces as well. And so we are going to be partnering with our other service providers to be able to get out to parks and provide that information. In addition to that, we are going to have some other media availability to be on radio shows as well as some print media and use our social media accounts to get that information out. It is very important for us to ensure that we are reaching those vulnerable populations. And it is important for us to ensure that our work is culturally and linguistically appropriate.
Wonderful. Okay, thank you again to our speakers and our pool reporter. I'd like to now ask our speakers if they have any final thoughts.
It is important for our community to know that we have available resources for employed as well as unemployed. We want everyone to know that we are here to support you. We have developed partnerships to ensure that our services are culturally and linguistically appropriate, and that we are partnering to ensure that the services are provided through an equity lens. And so we just don't want individuals to, if you have been diagnosed with COVID-19 and you're required to stay home for 14 days, we want you to stay home for the 14 days. We want to be able to connect you to staff that can provide you connection to rental assistance, to provide you financial assistance, because it is important for you to stay home and get healthy and be healed. And so we cannot emphasize the availability of these services. And we encourage our community to call 311 to inquire about the services that are available either through the City of Austin Public Health Department or our partners in the community. Thank you.
And thank you again for this opportunity to share this information. You know, I think there are three things which are really important to understand about what this document is that we've shared. This is guidelines based on risk. This is not a change in policy. This is not a conflict with the governor's orders. In fact, I believe it's complementary to the governor's orders. What this is a guide for individuals to assess the risk and to understand what they need to do to protect themselves and their family. We've broken that down into high-risk individuals and low-risk individuals. It's important for folks to remember that if they have a high-risk individual in their household, they should behave more like the high-risk individual themselves, because they don't want to risk bringing infection home to that individual who is more likely to experience complications, hospitalization, and die from COVID-19. Finally, you know, again, I think we're all engaged in the same mission, finding the right balance between public health and safety and keeping our economy open and strong. And if we can find that balance, if we can open things up in a safe way and maintain our personal safety, we can keep a lid on this. We can keep flattening the curve and we can stay open. Again, thank you for the opportunity. We look forward to having more discussions with you all in the future.
And that concludes today's press conference. Thank you once again to everyone.
Bill Dupree once again here in the KXAN live studio. We've just seen the conclusion of a briefing that the Austin Public Health, some of the officials there, just did regarding a new chart that they've released this morning that is supposed to help us kind of assess the COVID-19 risk here in our community and also potentially guide what we do in our decision making and kind of how we go about our day. I want to bring up that particular image really quickly so that you all can see it one more time. This is the chart they released this morning from Austin Public Health. Again, it lists things in stages, and at the moment, Austin Public Health says that our city and county are at stage 3, which is that yellow band right there in the middle. We want to take a closer look at it right there. And as you can see, at the top right there, it talks about different social practices, what we should do based on the risk level, which we are at stage 3 according to Austin Public Health. So that means we should practice good hygiene, stay home if we're sick, avoid sick people, maintain social distance of at least 6 feet, and wear facial coverings still. In that next column, you can see that if you are a higher risk person, so someone who's over 65 years old, has diabetes or high blood pressure or heart, lung, and kidney disease, or are immunocompromised or obese, here are some things that you should do. So in stage 3, you should avoid gatherings greater than 10. You should also avoid non-essential travel. You should also keep dining and shopping to just those essential trips that you might be able to take. Secondly, if you're a lower risk individual, someone who does not have any substantial health condition at the moment, you should still avoid any kind of gathering that's greater than 10. It doesn't say you should avoid non-essential travel, so that's something that can be done. And then it says that you should, you don't have to avoid dining or shopping or anything like that, except with some precautions. So keep that in mind. What is going to happen here is that this risk level, so they may be able to change the stages at certain points based on numbers and what they're seeing through public health data. They are going to have an update on what stage we are here in Austin and Travis County every single day. So right now it's at stage 3, and you can see those guidelines. We just talked about them a moment ago. And if the situation should change, either it gets better or worse, those stages could change, and it might guide us to do some things a little bit differently. Additionally, they released this particular chart, which we have on our website, kxan.com, and on the KXAN News app, so please download that. You can get a closer look at it there. Here are some other points they made just a moment ago with Austin Public Health. The Interim Health Authority, Dr. Mark Escott, did say that we are seeing evidence that we're flattening the curve here in the Austin-Travis County area. And he said that is attributed to changing behaviors with people. So people are listening and, maintaining that social distance, not gathering into groups of more than 10, and also keeping on that face covering when we're out in public. Those things appear to be working. He also, however, contradicted that and said we are not cured of COVID-19. It's not going anywhere at the moment. There is no treatment for it, nor any kind of vaccine. So the risk for it is still out there at this point. So please keep that in mind. At the moment, Austin Public Health also has the testing capacity for COVID-19 to do so for 2,000 people a week. They are increasing that capacity because of partnerships with other facilities. He did say that we have not seen a significant spike since the governor's reopening orders went into effect in the last 2 weeks or so regarding restaurants at first phase, and then slowly salons and things like that have been able to reopen. However, there was an uptick in hospitalizations here in Travis County, but he said that that went down, which is some good news there too. Going back through my notes, one question that caught my ear was that he was asked about people challenging this recommendation to still wear masks and face coverings at the moment. And he said it was, quote, ridiculous for people to say that that is infringing upon their civil liberties to recommend wearing a mask. He said this is a small step to protect other people and yourself. And he said, quote, it's critical to be able to keep businesses open and potentially even more to open at this point. So why not put that mask on? Keep it handy, keep it with you as you go out and about your day and do other activities. So that's important to highlight there too. Additionally, Austin Public Health says it has conducted testing for COVID-19 at 9 nursing home facilities here in our area. Again, that's 9 nursing home facilities for every resident and staff member at those particular buildings. And the governor has recently ordered that testing happen at every single nursing home facility or senior care facility in our state for both residents and staff members. And those 9 facilities, the testing there happened before that particular order from the governor. However, Austin Public Health is now working to be able to beef up its staffing and then go into the rest of the facilities that we have here in the area to be able to conduct that testing, because that population is incredibly vulnerable to not only get sick, but also to die. We've seen some reporting about that we've done here at KXAN News, looking into that threat for those kinds of facilities. Just going back through my notes to make sure we haven't hit everything. Again, if you would like to read a little bit more about this particular chart that we've kept up on the screen here, there is a full article over on our website, kxan.com, and on the KXAN News app. You can pull it up on there too. For now, I'm Will Dupree here in the KXAN Live studio. Thank you all for watching and paying attention to this stream. We'll be back throughout the day with additional updates, so please stay with us. Everyone, I keep reminding you, please stay safe and healthy, and if at all possible, still at home. Thanks again.